deep bony pain. That's the key line. You have to, again, you're discerning whether it's a secondary infection or a recurrent infection versus a dry socket. Dry socket, not a lot of swelling, but it's going to be a deep bony pain. They're going to talk about a foul odor in their mouth. You're going to complain about a foul odor coming from their mouth.
How many days after like a wisdom teeth extraction do you expect to?
You know, you know, this is funny. I tell people if it smells like a dog, if it barks like a dog, it's a dog. So if they come in with the symptoms, it could be the next day. It could be up to 2 weeks later. Okay, it takes about that long for the granulation tissue to. Again, in a layman's term, we always say we extract the tooth. You've got a bone exposed where the tooth used to be. It takes about 2 weeks for the skin to grow down and meet at the bottom, and now you're no longer at risk for a dry socket. And so it's about 2 weeks. All right. Simplest way that I find to do this is that anesthetize the patient. Either take the bulb syringe or we're trying to get the Monoject syringes. It would be nice if we have those. You fill the Monoject syringe. It's a I think it's a 20 cc curved tip plastic syringe. Has anybody had a dry socket and been sent home with one of these curved tips? Okay, so you know what I'm talking about, and we're trying to get those. And you put sterile saline in there, put it in the socket, rinse it out. Okay, mostly to get the food out, because there will be food trapped in there, which is going to be a continuous irritant and or a source of infection later if you don't get it out of there. So rinse that out. Then I pump the syringe to get the excess saline out. I will take a scoop of the dry socket material, and you only need a milliliter or so. You don't need a whole lot. Okay, and I put that in the syringe. Okay, so I take the plunger out, put this in the syringe, slide that back in, and then I put it in there, and I can inject it right back into the syringe or into the socket. Okay, and the key here is that normally the exposed bone is going to be at the depth of this, and so by just trying to put it in with a Q-tip, not always effective. Okay, the other way, if we don't get the Monoject syringes, I would take a piece of gel foam, and that's available to you. Okay, small piece. Roll it up into a kind of a tube-looking thing, and then smear this material all over it. Take it vertically, slide it in, and put it down into the socket. Okay, so then you'll see the material will also start gooshing out the top of it. And so as long as you've got the gel foam deep in there, that's good. Otherwise, I prefer to inject it in there, and then I'll take the gel foam and I'll push it in there. The gel foam will just hold it in place. If you allow the dry socket material to leach out, the symptoms will come back in a couple days.